Managing premium lenses in hypermature cataract is quite challenging. Here you see a hypermature cataract with intumescence and lot of intralenticular pressure. So the idle, we go in, stain underneath the air with trypan blue and push in viscoat. This high density viscoelastic gives a tamponade and makes the convex surface of the lens flattened so that we do not have a capsular run out. Very carefully, a small nick is placed right at the center so that the fluid can get egressed, and repeatedly the viscoelastic is pushed inside the anterior chamber to keep the anterior surface of the lens capsule flattened. A microrhexis forceps, preferably from the side incision 1.1 mm, is placed and the capsular rhexis can be completed. This maneuver helps in preventing the runaway of the viscoelastic from the anterior chamber and keeps the pressure maintained within the anterior chamber. Initially, the capsular rhexis so designed is smaller than the target size. A very careful phacoemulsification is carried out using the standard stop and chop technique. The last piece is very carefully emulsified to avoid the handpiece catching hold of the posterior capsule. A good irrigation aspiration using the bimanual technique. Lens polishing is must whenever we are planning for premium lenses. The residual cortical matter underneath the anterior capsule can be washed off, and using this simple polishing technique, the posterior surface can be made more transparent. A thorough cortical removal is a must. The rhexis can then be secondarily increased to the desired level once the IOL is placed. The IOL here is the symphony from the abort, which is an extended depth of lens. The lens goes and sits inside the bag, a small nick on the anterior capsule, viscoelastic inside the anterior chamber, and the microrhexis forceps can then be used to remove a frill all 360 degrees around 1.5 mm to ensure a good cover of the anterior capsule over the optic of the implant. By this technique, a good centration of these lenses can be achieved. Post-operatively, they do not induce any kind of abrasions. The wound is then sealed, a thorough viscoelastic wash, and the centration can be matched with the Purkinje images. Thank you.